So, good morning and good afternoon, colleagues. It's a very momentous occasion today, and it's great to see so many of you, almost close to 40 people joining in this webinar session, which is the first since we launched the Asia Pacific community of practice on community engagement and resilience or community protection. I hope that following the launch of the COP recently, that you've been able to join the WhatsApp group and that it's also helped to spark discussions and conversations in your teams on the importance of key investments in this particular area, which is emerging as one of the most important for managing emergencies and also for regular health service delivery issues. When we launched the COP, we spoke about the importance of placing communities at the center and how we prepare for, how we get ready, and how we respond to and also recover from health emergencies, irrespective of which hazard causes the health emergency. And in today's webinar, we want to put that principle into practice. And the focus here would be how to understand what communities are saying, asking, and perceiving in a very structured and ethical manner, and also to listen to this through online mechanisms at scale, building on the various efforts that have been ongoing for several decades, especially in terms of rumor tracking, etc., and community feedback mechanisms that have already been in place. Now, in today's session, we are quite excited to share with you the WHO Southeast Asia regional offices new social listening dashboards for priority public health risks. Now, it is not very pertinent, but then it is also very important at the same time for me to kind of remind all of us that we acknowledge that we are living in a very hyper-connected world. The rise of social media and digital engagement, especially with the advent of artificial intelligence tools as well, which also complicates matters, adds very many layers of complexity. But it also provides us a very key opportunity, as I mentioned, of listening at scale in a very ethical manner and in a very effective manner. But the insights that we are able to capture through social listening at scale, through online mechanisms and other mechanisms, can strengthen our public health efforts. You might be have read of the many articles that have actually come up related to the current Ebola epidemic that is actually currently going on, and how community engagement and then listening to community perception, even if we sometimes feel that we have already understood a particular epidemic, every new context and every fresh emergency occurring in a new location or even in the same location again after a break poses these kinds of challenges for us. Now, these public health, this social listening and the insights that we gain will strengthen not only our public health efforts, but also will really guide our communication activities, especially the risk communication and health promotion activities, and helping populations which are affected and in need to really comply with the public health measures that we are able to kind of put forward. Sometimes they are also able to detect early signals on concerning events or shaping how we deliver health services to better fit the community needs. During a crisis, understanding how communities are affected, their needs, their concerns, and the risks that they face in a very contextual manner, and quickly engaging with them, appreciating this specific context is very critical. We have seen oftentimes what happens when responses fail to take community concerns and context into account, and then do not engage them in co-creating the responses that are actually needed for specific emergencies. When such things happens, the emergency response itself gets derailed, not simply the communication efforts, but also the entire intervention, whether it is a prophylactic such as mass drug delivery or a vaccination campaign, or even early care-seeking behaviors, etc. All of them are undermined. And in the most extreme cases, we see that there is a breakdown of trust, social cohesion, and also they might lead to conflict. Just yesterday, I was reading an article which I shared with many of my colleagues, how many times we discount the fact that epidemics and pandemics and outbreaks do really cause some amount of rage against the healthcare workers themselves for various reasons. And if we do not listen to communities, and then we do not really contextualize our responses, co-creating it with them, this kind of rage and lack of trust is likely to increase rather than actually decrease. The chances are much more. But the good news is that the communities are already telling us what their needs are in conversations that they are having, and the conversations that are happening every day, both online and offline. If there are two people, we know that there will be three opinions, and so these multiple opinions and perspectives need to be really listened to. The challenge for us now is, as public health responders, is to listen very systematically, ethically, and empathetically, and turn what we hear into really bespoke actions for a particular emergency, and also for learn from that for future emergencies. That is exactly what these dashboards are designed to do. Many of you and many partners across the region are already engaged in various forms of social and community listening through community feedback mechanisms, as I mentioned earlier, rapid assessments that are actually done sometimes, monitoring of the media of various kinds, rumor tracking by community registers and such, and also direct engagement on the ground through various community-based organizations and various community groups, etc., from whom we are able to engage and then get this information straight out. Now, this work is very invaluable, and it forms the backbone of how we understand community needs and perspectives. Online social listening is intended to complement and reinforce these existing efforts, and not to either duplicate them or to substitute them. By adding a structured, real-time view of online conversations and perceptions to what you already gather through other channels, we strengthen our collective ability to triangulate such information and build a very complete and fuller picture to the extent possible of community sentiments, concerns, and needs. One thing we have heard consistently from you is that access to digital tools has been a key barrier. This is why our WHE Community Engagement and Resilience team has developed these dashboards as a shared regional resource. We hope that these dashboards that will be on which you will be sensitized, and on which my colleague Fern will actually take you through, and also the general principles about this, which Rose will also highlight, and the conversations and discussions that follow these presentations will help fill a very critical gap, especially the resource gap for you, and enable you to access and use them to support your own national as well as institutional social listening efforts. I hope that today's webinar provides you a practical step towards enhancing your social listening efforts at scale, and I look forward to seeing you put these dashboards to use in your own countries, in your own settings. And together, if we all do this in a consistent and standardized, uniform, interoperable manner, then we can also share such information amongst others and help each other to really contextualize the responses that we all are engaged in taking when it comes to emergencies, and also to prepare for them better. Thank you, and all the very best in your continuing efforts in community-centered emergency risk management. Thank you very much for the patient listening. Over to you, Farhan.
Thank you so much, Dr. Ruben, and thank you for opening today's webinar. Um, without further ado, let me just quickly share my screen, and I'll hand over to Rose.
Brilliant. Thanks so much, Fernan. And really wonderful to see so many of you online. Many new faces, but as well many old faces. So thanks again for joining us for the second webinar of our new community practice on community engagement and protection. For the new people around the room, my name is Rose Ainsley. I work in the WHO's Southeast Asia Regional Office in our team of community engagement and resilience. Before we kick off, and Fernand's going to go through the specifics of the dashboards, I'm going to do a little bit of a refresher on what is online social listening, and how we use it. So for many of you, we already know you though do social listening. So I've got a QR code there, and if I can please ask you to scan it, we would love to kind of get an understanding of what tools and which ways you're conducting social listening online. Next slide, please, Fernand. I think we've got some delays. It's not yet moving. Brilliant, thanks. Okay, so why do we do social listening? For those of you that already do it, I'm sure this is very aware to you all, but social listening provides us really critical information around people who are talking about their health. They're talking about their health often every day or regularly, and we now have a platform or ways in which we can tap into understanding people's questions, their beliefs, their experiences of health services. And we can do this through online social listening. We know, and we just heard from Dr. Rubin, the digital connectivity enables us a critical and really a great opportunity to be able to capture these insights around people's experiences, questions, concerns, and the rest. And it really provides us insights and feedback directly on health issues, services, and health programs that we can use to guide health operations and health decision making. Social listening, the tools that we're going to go through today, though, provide us an added layer of access by enabling us to systematically analyze large scales and large sets of data across multiple platforms. Next slide, please. So social listening insights, some of the insights that we can capture from this, I'm sure you're all very aware, but it provides us ability to answer questions where we might, let's say, see gaps between health guidances and the recommendations we're providing, as well as health behaviours. Because we're able to aggregate data on large sets, we're able to actually pick up trends, much like we would do as part of sort of epidemiological assessments. It's also in emergencies, we have the ability to collect anecdotal reports to understand people's concerns, needs, and impacts. So, for instance, reports that people are experiencing challenges accessing health services, or that maybe costs are an inhibitor to uptaking certain behaviours. It also tells us where people are seeking information and additional resources. So we can look at things like Google Trends, where we can see that people are really needing or seeking more information on different health topics. And during emergencies, this is really critical to help guide our risk communications interventions. But it also can tell us where we have information voids, where we are maybe not proactively providing sufficient information. And we know the risks that when we do this, the higher risk of those voids being filled with misinformation, where people seek alternate sources or identify other resources that might not necessarily be true or accurate. Next slide, please. So these insights often have historically been pigeonholed into sort of a communications-based response, but actually they provide us critical insights that can actually inform a range of different public health interventions and actions, both for emergency responses, but also for routine health programs. It might tell us that we need to improve our communications and that we've got gaps in or misunderstanding. But it can also, for instance, tell us really critical information, for instance, around gaps in health service delivery or challenges around access. So when you're capturing these insights, we really want to encourage people to see that they're part of a broader set of data that can inform public health action. Next slide, please. In terms of collecting social listening data, there are multiple sources that can be used. Some of those, I'm sure, exist in many of your health systems already. For instance, things like hotlines or email public queries. Other things like routine collection through patient feedback forms or other formal feedback mechanisms are really critical. We then have the sort of digital environment and user behavior, where today we're going to talk about our social listening dashboards and how we can actually collect data via digital platforms. So that can be collecting things on website analytics, search trends, monitoring social media, where we're seeing emerging narratives, or we're seeing trending conversations. Things like discussion forums like Reddit, where we can really pick up questions and concerns, and we can pick up people's feedback around different health-related issues. We then have what we would often say a bit more of our traditional community feedback mechanisms as well, where we look at things like feedback from community events, maybe opinion polls. Also, we have lots of colleagues on the call from IFRC, and I know that you're often doing community outreach, and that's another really critical way that we can collect people's feedback. So when we think about social listening, we can't use one singular tool or one singular method. We actually need to collect from multiple different sources to be able to build up a picture. Next slide. Oh, the delayed graphic. So today we are going to introduce to you the new social listening dashboards for the Southeast Asia region. And as Dr. Rubin mentioned, we've developed these as a regional good, because we heard from many of you that actually using some of these or having access to some of these digital listening tools, there's been cost barriers. And so what we've done is we've bought them and developed the taxonomies and developed the dashboards so they are accessible to all. But what we want to kind of reinforce is there's no magic dashboard that exists that's going to be able to cover all of your social listening needs. It needs to be part of a multi-source, let's say multi-source social listening activity. So whilst we really hope these are really useful to you, at the same time, we really encourage you to continue to collect social listening data from other mechanisms and other channels, and that you integrate the findings and use them to cross-analyze. Next slide, please. So just a little bit about the different social listening tools. So we do have a range of different social listening tools that are available. The dashboards that we'll be presenting to you use a TalkWalker platform, and we have developed taxonomies around a range of priority public health risks. But at the same time, there are other sources and tools that can be used. For many of you, I know that you might be, for instance, using Google Trends to be able to pick up trends in searches and being able to see changes in terms of the volume. So these tools are available. There are pros and cons to them. And so as you're going through this process, we would just really encourage you to, again, not just use the single social listening tool, but see that there are multiple tools out there, including what you might already have as other social listening channels, and see a way in which you can aggregate and cross-review some of the findings. Next slide. So one thing we do want to just, again, flag as a consideration when doing social listening is, who are we hearing and who are we missing? We know that not everyone is online and that there are gaps. Often some of these social listening tools provide us quite what could be assumed as definitive insights. But we know the data is only as good as what is being put into it. And we know that not everyone is online. We know, for instance, that vulnerable and marginalized groups may not be as active online, whether it's because of connectivity, because of language, because of costs maybe to use different platforms. So again, we only have to take into consideration who we are hearing from, but equally who we are not hearing from. So when we're looking at these social listening insights, always keeping at the back of our mind, is this representative, and which groups are we not hearing from, and which ways in which we can collect social listening insights from them if it's not through these large dashboards. Next slide. Finally, we wanted to reinforce that the social listening insights are really to inform broader public health decision making. Often we see social listening insights being defaulted to be only informing a communications response, but actually they should fit into broader public health decision making. It's really critical that we share these insights through regular reports, whether it's through our Emergency Operations Centre, through surveillance teams, for our programs teams. It needs to be considered and analysed alongside other data sets, for instance, EPI or service data, to really try and understand. So it's only a very small part of a bigger piece of information that we need to be able to guide our public health actions. And as I said, finally, we don't want these just sitting in a report, but we want these insights to really inform the way in which we deliver our programs or the operational responses that we make. So I'll stop here and hand back to you, Fernand, to kickstart and run us through the dashboards.
Thank you so much for that very brief refresher, Rose. And maybe if I can also just quickly project the answers or the responses we got from our participants on which tools have they been using. And also sorry for any technical delays in terms of projecting the slides, just really struggling here a bit. But there, so just maybe quickly running through what we've seen from the responses we've collected. So many of our colleagues are indeed have been using different mechanisms for conducting listening. Many identified TalkWalker, Google Trends, and also using offline mechanisms for understanding community concerns. Other participants also told us that they haven't been using some online tools, but most definitely there are other ways of how do you hear or how do you listen to communities, may it be on an emergency or may it be on a non-emergency setting. Let me just
It seems
switch
like
back
lots
to...
of people using TalkWalker, Fernand. So maybe when we go through this, it'll be a reminder for all of, a very easy kind of run through on the session, but it's really great to see so many that you're already using and really looking at lots of different ways in which you're different sources. So yeah, over to you.
Yeah, totally. And I think it also makes our lives easy today in terms of showing them around the dashboard. But mainly what we'll be sharing with you now is how how do you actually navigate the dashboard that we've created? For sure, especially to those who are already using TalkWalker, you are already aware of the basic functions, the filters, and things that you can do, the myriad of things that you can do on the on the platform. But each dashboard that you create for TalkWalker will vary depending on your needs. And for our region, this is what we developed. So if you're interested in seeing it now, you can scan the QR code and that will bring you to the dashboard that you're seeing on your screen right now. We have developed 2 dashboards so far. One is on listening on the priority diseases in the region. Just to also note that the diseases that you'll see there is not final. We've been adding many other diseases that were identified as a priority for the region, also in coordination with our country offices. And also there's another dashboard for priority hazards. Let me drop in the chat the link to these dashboards if you cannot scan the QR code. So there. So those are the 2 main dashboards that we have built to support listening. But maybe if you are using your computer, great if you can go to the dashboard so that we can go to each functions and widgets together. Those are publicly accessible links, meaning if you don't have a login access, if you don't have an account with TalkWalker, you can actually see it and use it. The only difference is that if you have an access, you have your TalkWalker access. If you have a login details, then you can deep dive, look into the data, look at the numbers, look at the social media posts that have been driving your results on your dashboard. So, but if you don't have access and are interested, we are also happy to provide you access. We'll be providing you the details on who to write and how do you actually get access to this to the platform. Now, just maybe as you are, I'm assuming that you are looking at your screen now, trying to check the dashboard using the links that we provided in the chat. But thinking about the scenario, and let's have country X, for example. So maybe the main question really is, why do you need a dashboard, and when is it really usable compared to, for example, just doing a quick search online using Google Trends or using Talkwalker or Netwater, those brands, and doing a quick search to check. So in this scenario, like for example here, we have country X is 6 months into a protracted flood emergency, and you have a displaced population relying on temporary health services and aid distribution. So the task is for your team to monitor community sentiment and feedback, to identify if there's a need to improve access to services, or how do people think about or talk about aid distribution, or understand emerging needs in these temporary health shelters, health services, or in maybe they're in the shelter. I'm sorry. And to monitor that in a protracted emergency, you will require continuous monitoring. And that's where a dashboard setup might be useful. You might want to think about how do you understand shifts in conversations as the response evolves, or maybe if you do a continuous listening for 6 months, for example, or onwards, you will need to have a comparable update on different community concerns, or which could definitely support decision makers in making policies, for example, or addressing the needs of those population affected by the protracted emergency. And the dashboard, if you set it up, it can probably cover key themes like maybe health service access, and then water, sanitation, and hygiene. And also maybe another theme that you want to monitor are emerging rumors or misinformation. And having that dashboard set up, it allows your team to do a couple of things. One, maybe to monitor conversations volume and sentiment over time, or compare different themes, trends relative to each other, or detecting emerging concerns early before before they escalate. I'm seeing in the chat some concerns about the access, but please keep flagging them. I'll be assisting you on how to access them. Maybe there's some, depending on where you're coming from as well. In some regions, in some countries, I think there might be some difficulties accessing these dashboards. There's certainly a workaround like VPN or such, but I'll get back to you, Kevin. And just maybe on the value before we jump straight into the dashboard, the value that this gives you, going back to the slide, this gives decision makers consistent and comparable insight into how the situation evolves throughout the response. So let me switch to another screen here. Give me a minute, please. So when you scan the QR code, it should bring you to this dashboard. So if you're seeing this on your screen now, please, yes, you're seeing my screen, but if you're also able to access it by yourself, it's actually nice. And allow me to, please I'll turn off my camera because, so to conserve bandwidth. So the dashboard, as you see, will have a range of widgets here, which can give you a different information, which could support different activities. For now, we're using the dashboard priority diseases as an example, but we also have a dashboard. I've mentioned the dashboard on monitoring earthquakes, conversations around earthquakes and floods. In the near future, we'll have landslides as well in the monitoring dashboard. In the dashboards. But what you're seeing now is the priority disease dashboard, and we've built this to support the listening on a range of topics. You'll see there, if you do look at the sidebar navigation, just hover the mouse to the left, you'll see different diseases there listed alphabetically. You have the Ebola virus, Bundibugyo virus disease, cholera, dengue, hantavirus, measles, Nipah, rabies, and seasonal influenza. You can freely click on it, but I don't think I have the time to really show you around all these sections. But another presenter today who's generously said yes to presenting or sharing their experience on using the dashboard, we'll be talking about some of the sections here, which is also similar to how we tailor it for country support. But on the landing page, I will be focusing on the landing page. You'll see a quick snapshot of what's happening or what people are talking about in the region. First, we have here the volume of results by topic, which gives you a picture of which topic has been generating data within the 30 days. So the dashboard has been set up for that time frame, 30 days. But you can also modify this if you have access to TalkWalker. Again, if not, if you don't have access and are interested to use the filters and use the other functions, please write us a message. We'll be giving you the email address where you can request for the access. But for this publicly accessible link, you can see all these without having problems. So here, as you see, dengue will be the #1 topic that's driving the trend lately. And then on the right, you see the share of topics, which gives you a perspective of what topics are like in comparison to other topics, like which topic has been being discussed more in social media or in digital media platforms. And then how can it be used? For example, maybe it helps you monitor trends or unusual increases in discussion that may align with outbreak activity or media reporting. Can also compare public attention across multiple priority topics, helping you guide cross-sectoral response planning. Like, for example, if I set the filter on one country, maybe let's say India, and you'll see that maybe I can actually do that now. I'll go to the version that has full access. So for example, if I add a filter here and select India, for example, here, just to show you that even if it's showing you the regional data, you can actually use the filters to narrow it down to your country. Like for example, here now we have India results. You can compare through the share of topics, see which topics are being like really driving people's attention within that country. And then here, let me just remove the filter again. Here, you'll see on the left, you can see my cursor. It's showing you the overview. It tells you the number of results, at least the total number of online results, along with percentage change compared to the previous monitoring period. The green arrow, you'll see a green arrow here, for example, here. It tells you that there's an increase in mentions. And of course, the red arrow pointing down tells you the decrease in mentions of, for example, in here, we're seeing conversations on topics on these. But let me just remove this. If you have any questions, please feel free to flag it in the chat, or you can also raise your hand. Happy to answer them as we go along. And then there's also this map, which would be really helpful for those who would want to understand the geographic distribution of online discussions on priority health topics across the region. Each bubble represents the volume of online mentions originating from or associated with a specific country. Like for example, here I'll go to Sri Lanka. If you hover your mouse on top of a bubble, it will show you the distribution in terms of the number of results generated per topic. Like here, you'll see for Sri Lanka, 2,600 results are coming from dengue-related social media posts. And then the rest, you see BVD, rabies, seasonal influenza, hantavirus, and measles. So having this kind of, you can actually even zoom into it and even see more granular result here and find where in which regions those conversations are coming from. And this can help you maybe identify hotspots where online public interest and discussions are increasing. You can also cross-reference online signals with field surveillance or media reporting. It can also help you maybe detect potential early warnings of outbreaks, rumors, or public concerns, and inform you of maybe it can also inform country-specific response planning and resource prioritizations across member states. So there, so these, and lastly, in this landing page, we also have the results over time. As I mentioned earlier, the data here is generating 30 days worth of data. But again, if you log in, you can actually do that if you have Talkwalker access through the public link. You just go to this button on the upper right. You just click on Go into Interactive Dashboard, and that will prompt you to log in. And once you're logged in, you can see all the details or the social media posts that has been driving the results here. And what I'm doing now, I'm looking at the results over time. I can also change it to 7 days. The time frame is here. The time range can be found here in this filter bar. You have 1 day, 7 days, 30 days. And now maybe let's just use the 30 days and let's see what's driving the conversation here. So here you see the purple line representing dengue. Scrolling up, you see the color representation are here, purple for dengue, etc. And let's see what's happening here, what's driving the conversation. So if I click on it on the peak, I can click on any point on the map or wherever in the dashboard, you can click at any point so that you can have a snapshot of what's really driving the conversation or the trend. You'll see here some social media posts that has been driving the conversation. And you'll also see some metrics on the right telling you how many people have been engaging it. It also shows you the reach and for example, this account, it's telling you, it can also tell you the number of followers that account has and many other useful information. There's also a range of buttons here. I'm not sure if I can show you now, but there's a range of buttons here that you can use to really understand what's making this particular post, for example, more engaging than others. In terms of use, maybe you can also think about it, for example, in the comms perspective, you can also think about what kind of social media posts or what kind of messages or what kind of intervention, if you're not thinking around communication, what kind of intervention is working within your community or in terms of in your response or in terms of your campaign. And if you look at other, for example, here, if you look at All India Radio News, you'll see the platform is flagging that it's driving a good sentiment, meaning a lot of positive responses. Again, this is AI-driven data, so you will also want to deep dive. You also want to investigate by yourself, because sometimes, of course, AI cannot be relied upon in terms of understanding people's emotions or how they really feel about a certain message or intervention or public health measure. So in that context, you can deep dive and see what kind of messages or what kind of intervention, what public health measure is really working for your population or for your target community. Now, Rose mentioned earlier about taxonomies. You'll see here as well that you'll see that we have some tags here. We call it tags in the language of this social media platform. And it kind of gives you an idea of what's the main themes that's been driving the conversation. Let me maybe better to see from here. Let's go to dengue. So now I'm going into a section where you can see topic-specific dashboard. What I did, I just hovered my mouse to the left, and then I saw the sidebar, and then I clicked on Dengue. Now, and then if we scroll down a bit, you'll see here, just let's give it a minute to load. You'll see here a range of topics or themes, I'm sorry, that tells you what particular concern has been driving the engagement. As you can see, all the arrows are green. It tells you this. There's been 100%, for example, increase in terms of conversation or discussions around the cause of dengue. And then the system also tagged that there's also an increase in terms of conversations around treatment and prevention, a 450% increase. And if you want to deep dive again, you can click at any point here. For example, there, I click on that data telling us that there's an increase in conversation around treatment and prevention. And as you see, India has just introduced their very first dengue vaccine. So it's really helpful in the sense that you can see why people have started talking about it. And then here we'll also share of engagement, meaning which particular concern is driving the conversation. Like here, you'll see 35.7% of the conversation is around treatment and prevention. Now, going back to the taxonomy, this has been built, these tags have been built around the taxonomies that we've created at the back end, integrated at the back end of our TalkWalker platform, that we use a combination of keywords that kind of filtered or allows us to check the keywords that has been linked to a cause, linked to treatment and prevention, or linked to symptoms, etc. And in that manner, we are able to trace the conversations on those identified themes through our taxonomies. Any questions so far? I think I will have to stop here. I'm also conscious of timing. Or maybe the questions, we can also have it in the Q&A session. We have a Q&A session. So let me just move back to the slide. I'm sorry if this is taking some time. Right, and just a few more things. Now I can show my face there. Yes. So there's also other things you can do. So if you do want to have access to our TalkWalker platform, please kindly send your request to apcpcore at whoi.int. We'll be very happy to provide you access, and hopefully this can support your campaigns or your public health initiatives, and any work that you've been doing. And the reason why I'm saying this is if you have access to the tool, other than accessing our dashboard, you can actually jump to other functions like the quick search. You can also really look into doing the searches by your own. You can, and for example, using the quick search function, you can run your own search on, for example, in this, that's what you're seeing is I've just added keywords dengue and outbreak, which will bring me a result of conversations around dengue and outbreak. We are also providing an online social listening platform quick guide as a resource for you to just really get started with using the social listening platform that we're introducing now. There's also a range of resources available online. We'll be providing this PPT, I believe, after the webinar. Again, WHO have been doing social listening, but also our partners, UNICEF, IFRC, and many of our colleagues in the call as you have also informed us, you've been doing social listening, and there's also a range of resources you can use to really strengthen your social listening skills. And on that note, I'll end my presentation and I'll hand over to Dr. YY.
Thank you. Thank you, Dr. Fanan and our colleagues. Good morning, good afternoon, all colleagues. I am Wei Ao from the WHO Myanmar Disease Surveillance and Epidemiological team. So thank you for giving me this chance, the opportunity to share our Myanmar experience in developing and also how we are used the social listening dashboard to support the public health preparedness and emergency response. So next slide, please. Today, let me brief describe the background and how the Myanmar specific platform was established and key dashboard features and how the insights are being used to guide the risk communication and operational decision making. Next slide, please. So let me start with the background and rationale of our social listening activity in Myanmar. So the need for social listening became evident when the nationwide acute watery diarrhea outbreaks in 2024. So this outbreak started in Yangon and rapidly spread to the other states and regions. So at that time, Myanmar was facing the humanitarian challenges, population displacement, and the monsoon season impacts, and also the communication barrier in some area. So with the support of the WHO CRO team, we initiated a social listening activity, and CRO team provided how we monitor the social listening activity of the community concern questions and rumors and misinformation, and also the public perception related to symptom treatment and the health-seeking behavior. So regarding, according to the finding from the social listening, we can improve our actions such as we quickly develop the information gap for the AWD, RCC material, and we can address the misconception among the community, particularly for the vaccine hesitancy and information sharing for the vaccine campaign. So next slide, please. Similarly, we have another public emergency event occur in Myanmar, as all colleagues were also aware that in 2025 March, we have experienced the earthquakes. So magnitude 7.7 and 6.4 affect to the central Myanmar, and following the earthquake effect, the consequences came out, such as the destruction of the wash and sanitation services and increase the risk of the disease outbreaks. So at that time, during the first month of the earthquake response, CRO regional office again supported and provided to us the daily social listening reports to Myanmar. So according to these finding reports, we can quickly help to the community what are their information needs and what are the service gap in the earthquake affected area. And then we can also deploy the emergency medical team to the mostly earthquake affected area, and also other business need assessment, logistic and field operation as needed according to the findings of the social listening. Next slide, please. So with this past experience with the public health emergency, we are willingness to institutionalize the social listening activity in our country. So as a initial step, WHO Myanmar focal person participated in the CRO-led training for the social listening in September 2025, and then we have created our Myanmar specific dashboard, and this dashboard can review by anyone with the link, but detailed investigation capacity remain restricted for the science focal person in Myanmar. Next slide, please. So let me share key step-by-step how we develop and use this dashboard. So the first step is to identify and the public health risk in country. And based on this, we have selected 5 priority topics with discussion with CRO team. And these are the public health, current public health situation in Myanmar. So these diseases are common and happening in Myanmar. And AWD, measles, rabies, dengue, and influenza. And then we also added Hanta, Ebola, and Nipah because there is a growing public concern and increased interest during 2026. So we have expanded, and we also plan to expand the other topics such as mental health, flood, which are very common and happening in Myanmar. And the second step is the integration of the data source with the dashboard. So with the help of CRO team, we have integrated WHO Monitor social media community page online source that are using in Myanmar and connect to the dashboards. And so after that, finally, we have established our own dashboard, and we monitor and analyze the data from the dashboard, and we have generate the actionable reports for the public health action since 2026 January. Next slide, please. And let me continue for the dashboard feature. This is the tracking of the volume, mention, and the user engagement over time. By comparing the results and engagement, we can know the sudden increase in conversation volume, which indicate emerging fear among community, and also the spike in the engagement. And also, we can know that there is a misinformation signal spreading among the community. So such kinds of changes in community attention often occur before the formal reporting mechanism. So this feature provide the early warning capacity for the public health team to identify the signals. Next slide, please. So this is another feature, results over time and net sentiments over time. So this feature also help us to understand why the discussion are increasing among the social community. For example, rising the negative sentiments in the chart, there is a red wave. These are the negative sentiments, so which indicate the anxiety and distrust among the community. So, and also the positive sentiment, which reflect that our information dissemination is successful and people aware their information. So this insight could help us the real-time socially grounded recommendation for the public health emergency. Next slide, please. So this is the regional specific breakdown. So this regional specific breakdown also help to identify the geographic variation in the discussion. So for example, we can compare number of posts, number of results, and also number of the author. So this tells us the conversation are widely spread across the community or driving by only the few active counts. So such kinds of information help us to prioritize the location where the deeper investigation or the targeted engagement activities. Next slide, please. This is the share of sentiments. So this share of sentiments can help us which region with the higher negative sentiment we require strong community engagement. For example, with the negative sentiment in the red bar, this is we need a more community engagement activity at these regions. So such kinds of evidence-informed communication, we can do that. Next slide, please. So this is the last session of my presentation. So by using this dashboard, we can generate the insights for the public concerns, rumors, alleys, and we can monitor disease-related perception in real time, and we can identify the geographically risk pattern and detect the information and service delivery gap, which areas the service delivery are demanding and gap for the information. So such kinds of insights we can know from the social listening dashboard. We can listen to the community and we can detect the risks early. Next slide, please. So by using these insights into the response, we have tailored our risk communication and community engagement strategy activity, and also we can prepare and plan the emergency response for the decision making of the public health emergency. So in conclusion, the social listening activity helped to Myanmar team to listen what community are saying, and we can detect early signals of the risk, and also we can act faster for the public health response, and then we can save and to the lives of the community. So this is a very valuable tool for us for transforming the community conversation into the actionable public health insights. By combining the digital listening and also the offline community feedback by coordination with the partners, we can strengthen the risk communication, preparedness, and the emergency response across in Myanmar. Thank you so much, all colleagues. As we are learning for the social listening from our regional college. Thank you so much, our regional college, for your technical guidance and support to us. And also, thank you all colleagues who are experts in the community engagement and protection area. So if there is anything needs, let me know. Thank you so much.
Thank you very much, Dr. YY, for sharing your country experience. And I think our colleagues will definitely learn a lot and will benefit from the experiences that you've shared. And really, really grateful to you and your team. Now let's jump to our discussion and Q&A session. Also recognizing that we're running 10 minutes late. Hope we can have more conversations, but we'll try to limit this to 10 to 15 minutes. Also, as we have the discussion, please also, if you're, again, I've been seeing in the chat a lot of questions about how do we access the dashboard? How do we use the tools that have been presented, or how do we use the features that will allow you to deep dive into the data? Just please scan the QR code here. I can also just copy the link once we share the PPT with you. It will bring you to an MS Forms, a survey that will let you tell us if you are interested in a couple of things, like maybe access to the dashboard, or just really having access to the quick search function, or the other filters that you can use within the dashboard, or maybe social listening training, or or maybe some very specific or skill specific activity that you will want, especially for those who are already using TalkWalker. Maybe if there's certain features that you wanted to really be more comfortable in using, then maybe we can also have that follow-up session. So just please flag those in this survey. Yes, if you have any questions now, I think now is really the time to have the conversation. And if you can also just kindly turn on your camera if you want to, if you're comfortable, that would be very nice, to see your beautiful faces.
I know it's always intimidating going first, but I see, Mom,
I see a
you've got
couple of people.
your screen off, so maybe that means you'll be the first to jump in.
Fernand, please stop sharing. Thanks.
Sure. How do I do that? There. Okay, no one can see my screen now, right? And the floor is open.
All good, all great. Does anyone want to jump in with any questions? Although I can start to pull some from the group, but I see lots of everyone's faces is coming on online. So please don't be shy. Just unmute and please introduce yourself and ask your question. Thank you. Okay, maybe people are not yet ready to ask directly. So I do though have a question around from Kamaraj. I hope I'm pronouncing your name right. Around what mechanisms are available in the dashboards for social listening for marginalised and vulnerable groups, for instance, children, elderly, people living with disabilities. How do we know that we are listening to all the communities and no one is left behind? Maybe I can just start and just mention this is exactly why I referenced in my initial presentation is we know these dashboards are not complete and they often miss subsets of the population. And so we can't assume that this dashboard is going to be able to generate really critical insights for often those who are most at risk. So that's why we need to complement them with other sources that are more direct. And Dr. Waiwai mentioned that again in her presentation. Where are we seeing gaps? And therefore, where do we need to find other channels? And that might be, working directly with community leaders who are providing insights. It might be thinking about how can we collect this data through, let's say, our health service providers that are having day-to-day interactions with some of these group, maybe people living with chronic conditions or other people who have contact with different parts of whether it's the health system or other broader social programs. So in terms of the dashboard, though, there is some ability to kind of do some mild tweaking. So maybe, Fernand, you can just touch on the parts around the age and the rest.
Yes, thank you, Rose. And again, we cannot emphasize enough the need to triangulate, especially if, for example, you're seeing some social media posts on a certain topic. But we're missing some of the communities or some members of the community that we actually wanted to target. Then that's when we also wanted to see other data sources, identify other tools. But within the dashboard that we have presented today, there's also other ways on how you can do this. Maybe the easiest one is by adding a keyword. Let me just share my screen so that you'd actually see what we can do. So that we can do it together as well. If you're using your computers and you have access to the dashboard, or you have login and you can go to the dashboard, that's really helpful. So as you see here, I have, so I used my mouse and hovered to the left and I clicked on measles, for example. And then you have the filters bar here on the top. And then if I click on filters and I type, we can do the text filter. For example, if you are wanting to see some social media posts about babies or anything that's related to children as we think about vaccination, then you can type the keyword here. I can also actually do that now. Or if you're more concerned about the demographics, like there's also here, there's a filter here. You just scroll down. Here you see the sentiment, topics, channels, content type, can be video, audio. There's a range of filters you can use. Even the media type, if you just wanted to focus on X or Facebook, you can also do that. Countries or regions, like even within the country, you can even make a granular search. Like if you're targeting, for example, just New Delhi, we can also do that here by selecting the country there. Like for example, here I did India, and then you can select Delhi, then it will just pull out data coming from Delhi. The same with the demographics. We can also do that here with some social media platforms or digital platforms that provide data on age. We can actually use that filter here. by selecting, for example, 18 to 24, those who have been posting about a certain topic at that age, then we can do that. And until this age. Of course, below 18 is not here. We hope they're not using social media so early. But the data collection here is, of course, guided by ethical practices. I'm also looking at protecting vulnerable communities too. So, with the question, sorry, maybe we can try this. We can use baby as a very short, very quick. I selected. Sorry about my computer. It's just really hard to share and run the dashboard at the same time. Also, that's also maybe something that we might want to consider. So I'll close the filter because sometimes the bandwidth, depending on the internet speed, from which country you're coming from, that's also consideration. So there, as you see, I've added the text filter baby, and then we'll be seeing, if you scroll down in this section, you'll be seeing social media posts talking about vaccination of babies. So there. So there's a way for us to really also check on that. But also it's another conversation altogether, talking about what, when, for example, we're supporting the Ministry of Health or supporting other institutions, then how do we actually do the data sharing? The best practice usually is you want to anonymize the social media posts. Whoever is, for example, creating the post, great if it can be anonymized. Reports are usually, for example, in our context at WHO, we make it internal. And yeah, I think I'll stop there so that we can take more questions.
Great. Thanks, Fernand. I know that we're nearly at time. I think one of the things that we maybe just wanted to emphasize is the full functionality and the ability for you to filter per your country will come once you ask and request for the broader access. For the dashboards that we've developed today, they are for a range of priority public health hazards and for priority public health diseases. What we've used our regional risk assessment to select and build those dashboards and taxonomies aligned to what we know are the biggest risks and biggest impacts in our region. However, we know that you may want to use this for some of your other routine programming. So for instance, many of your countries are implementing new vaccines like the new HPV vaccine. And so through the quick search functionality, whilst you might not have a standing dashboard, you will still be able to aggregate and collect some of these insights that are specific to other public health issues and topics. So again, we would love to be able to make this has been developed as a regional good. And so please do email us via the email and the QR code that links to it for the registration form. Then we will provide you access. And as Fernand said, to help you in terms of the onboarding, we're really happy to be able to see how we can provide training and a bit more hands-on support to actually use the functionality that's in the system. And thanks very much, Abby, for putting the email back into the chat. So I'll stop there and back to you, Fernand. I can see Ruben's hand.
I can see Dr. Ruben's hand.
Yeah, thank you, Fernand and Rose, for explaining, and also for colleagues asking some questions. So this is related to what Rose mentioned last. So if we are using a free text to really look at some new topic, etc., the rest of the filters can still be used, right? When you talk about the country, the demographic, etc. So those remain. So it's only the topic that you're actually kind of, instead of looking at measles or whatever, which is already standardized and put there, you might want to kind of, use a new search terminology. But all the other filters will still remain for you to be used, isn't it?
Yes, the quick answer is yes. You can use the filter so long as you have access to the platform. But if you're accessing it using the public link that we provided, then you cannot use the filters. So if you're really interested into really doing more tailored listening, for example. Like, for example, we have a dashboard on measles, but you want to really narrow down the listening to a specific topic or a specific demographic in that sense, then you'll really need the filter feature, which can only be used if you have access. And Abby has kindly provided the email address where you can write to request for the access. And I think that's really helpful for you to also, I think the filter function is really very helpful. And something that we've also not covered, there's a quick search function here too. If the topics that we have created through the dashboard is not of interest for your country, for example, then you can also perform your own listening using the quick search function, where you can run for example, you can type malaria. That's one of the topics that we want to build as a dashboard here, but we don't have it yet. But you have some urgency on understanding the malaria campaign, then you can run the keywords through the quick search function. And also, of course, you can email us and we can also support you in doing that listening, really looking at how that quick search can be more specifically targeting the conversations or interventions that you wanted to understand. Oh, we're down to 5 minutes, I see. So maybe before
One more,
not really
one
5 minutes,
more,
we have
one
9
more.
minutes. I'm sorry. But we have more questions, please. Maybe we
Yes,
can take one or two.
one more question I wanted to ask, if I may. That is, you talked about anonymizing, right? And then when you filtered it down to the actual postings, we were able to see the names of people who actually posted. Does the tool, the platform actually allow, even before actually your, while all the other things might remain in terms of the age and the various other demographic, etc., is it possible to not see the name at all in the post, so that because when you see a post with a name and things like that, etc., that might actually kind of lead you to some false conclusions or kind of induce some biases, etc. So is that feature possible? Thank you.
The TalkWalker platform that we're using is not designed to anonymize the sources of social media posts, for example, or if sometimes maybe it's a blog or a news item published by a certain press company. But I think that's also the reason why when we do the reporting, and which you usually manually create, then that's when you want to, that's the work around it. You want to anonymize the identity of those individuals who are clearly identified in the platform itself. But going back to the point earlier about the public link, if you just use a public link, then it will not really allow you to dive deeper into the social media post or who this person or individual who posted that particular content. That's not actually possible with the public link, but only if you have access, then that's when you can really go into the details and see in which country this post is coming from which influencer this post is driving, and how is it spreading. That's actually can be mapped within this tool. Maybe one more question, then let's have a group photo if that's okay with everyone before everyone leaves. And of course, we'll still have a closing remarks and some announcements.
Maybe I can just say one thing, Fernand, in response to, there was questions in the chat regarding EIOS. So many of you might know what EIOS is. It's a tool that's been developed and supported by WHO that supports media monitoring for surveillance activities. So EIOS helps you detect media reports that could be signals and used in surveillance for follow-up. There was a question around, does this integrate with EIOS? No, it is not integrated. However, what we're planning to do and what we're using is we're gathering the social listening insights and sharing it also with surveillance colleagues who can then use that to inform that broader picture of drawing the picture around a potential event. The difference between EIOS is it often picks up media reports or more structured reports, whereas social listening via our platform actually enables you to pick up on conversation trends, something that wouldn't be picked up necessarily with EIOS. So you're able to look at social media and public commentary, which EIOS currently doesn't have the functionality to do. But Fernand, jump in there if there's anything that I've missed. But just to say, these are two complementary tools that we should be using to sort of not necessarily aggregate, but both analyze in order to build a kind of picture of a public health event. So it might be EIOS picks up a signal, and then you use the social listening dashboards to actually do a deep dive into understanding people's perspectives, concerns, and impacts that can really help shape or understand an event. But I'll stop there, and maybe Fernand, you have something to add on, and also Ruben, thanks.
Just to emphasize the point that we have this dashboard, but we also want to, of course, like for example, EIOS and other tools available online. Some of them are actually free, which will help you fill the gap, or also really understand what, for example, EIOS can provide you, but Talkwalker cannot provide, but Talkwalker can tell you other things like social perceptions, community concerns, which you may not be able to see in other platforms. So I see two hands now. I give the floor to Dr. Ruben first and then to Dr. YY.
Yeah, thank you, Fernand and Rose. I think it is important to stress the kind of distinguishing features in terms of objectives. EIOS is primarily focusing on detecting events, public health events, disease events, early warning signals and alerts, and not so much on the perceptions and the community kind of talk and thought, etc. So that's not the focus. So that is where the difference actually arises. Of course, one can always configure something to do what it's not really meant to do, but then it is much more efficient to kind of use EIOS for event detection and the social listening platforms for the stuff that we talked about in detail in this webinar. But there is also a give and take between these two platforms. The way that we are actually trying to address that at the regional level is that if in case we are detecting certain events, and we also have a constant actually dialogue with our team, which is actually doing the public health intelligence. So we have this dialogue, and then if we detect any events through this particular platform, then we share it with them to follow up. Right, and then so that way the team which actually is responsible for event detection does event detection, and the team which is responsible for looking at feedback, perceptions, what community is thinking, what the community is talking, etc., can be actually focused on. And then finally, these two are complementary, especially when it comes to an impending emergency or an actual ongoing emergency, etc. Thank you very much.
Conscious of timing, Dr. YY, please, I have the floor.
Yes, thank you so much, Dr. Ruben, Dr. Fernand, and Dr. Rose. Let me compliment one thing is in one strength of this social listening platform is we can monitor the news from the Facebook social media Facebook page. We can connect the Facebook page with the dashboard. So in Myanmar, most of the community are using the Facebook, so we can know many perception of the community from the Facebook. So let me compliment this one. Thank you so much.
Thanks for adding that, Dr. YY. It's actually really a helpful reminder that a lot of media companies now, especially those in, for example, doing broadcast, they also have their social media channel. And they also sometimes, it would be easier to pick those up as well, especially those who are media reports. They also have their Facebook pages and they kind of post there. And sometimes it's since the dashboard that we presented today gives you real-time data, then there's no delays in terms of like really seeing the data come in. Like as soon as they publish something online, then you can pick it up through the dashboard that we have created for the region. I'll hand over to Dr. Ruben for some closing remarks.
Thank you very much, Fernan, Rose, YY, and also all of you who actively participated in this important kind of milestone webinar as part of the Asia Pacific community of practice on community protection, and for the engaged discussion both through chat as well as during the Q&A session. The comments that you typed in chat and then the questions that you raised really gives us more insights into what exactly we should be focusing on while actually moving forward and working along with you together to really make use of this dashboard. So today's webinars has shown us the value of listening closely to our communities, understanding their concerns and questions, and using these insights to inform public health decision making, especially during emergencies, but not limited to emergencies. The tool and the dashboards that Fernan introduced today, especially also the experience that was shared by YY from Myanmar on what they have actually done using these tools, really ground the importance of these type of standardized forms of platforms, dashboards, tools, and other technical aspects of social listening at scale. And they also give a good glimpse of how it is possible when we combine a strong data triangulation with genuine community engagement. So as I mentioned in my opening remarks also, it's not that we are substituting what is actually happening in real time in the interface at the community level face to face, but rather we are making use of these newer developments in technology and information and communication technology, social media, etc., and also artificial intelligence to complement it and then make it much more robust. So before I close and we kind of finish this seminar, I would like to highlight a few points. First, please join the WhatsApp group if you have not already done so. And as Abhi explained last week, this will be our space for ongoing exchange, quick updates, and peer support till the community of practice related website and other tools are also finalized. Second, if you're interested in being onboarded to this regional dashboard that Fernan introduced today, or would like to learn more about the various platforms and functionalities that are available to support your social listening activities, either at institutional level, national level, etc., please reach out to the APCP Corp Secretariat with the email address that you find right on the slide, apcorp@who.int. Third, I want to assure you that the WHO Southeast Asia region, together with our partners, UNICEF, IFRC, etc., that have joined us in this call, will remain available to provide technical support as you take this work forward in your respective countries. And please don't hesitate to get in touch as questions, queries, doubts, even ideas that actually emerge as you start using the platform in a much more systematic manner. And we have set up a stream under the Community of Practice WhatsApp, specifically on social listening and infodemic management. Please, if you want to join this, that will be great, especially if you are interested in this particular stream of work and not the entire work that is being done by the Community of Practice. So you could join that, but you could also join this specific stream. Finally, as you have clearly expressed, both in the interactions, in the chat, and also in the discussions, countries and partners have, and also through the resources that Fernan actually shared in one of his slides about the global and the regional resources that are already available, it is quite clear that many people are, many institutions and many countries are already using other tools, platforms, and functionalities that work with probably differing levels of efficiencies. We would like to learn about these as well, especially the various aspects of learning from experience, of the issues that have emerged, the challenges that you have faced and overcome and what you have learned, so that we can improve this shared regional online listening dashboard. And also, we don't have to duplicate or reinvent the wheel, especially if you have already created dashboards, or you already created search words and various other taxonomies for certain public health priorities that are already not in the platform, rather than us kind of inventing it from scratch and drafting it in scratch. We can actually take your inputs and we can actually then have a consultation and go forward, so that we have a lot more specific dashboards that are actually available. I would also urge you to make use of the taxonomies, the search logic, the filters, etc., that are available and other technical and operational functionalities of this dashboard that Fernan was trying to make, as good use of, given the constraints that he had, but lots more is actually available. Please try to use them so that whatever dashboards and whatever functionalities and whatever tools that you use for your bespoke activities, they all can move forward towards some level of standardization at the regional level, and so that all of them can become efficient in conducting online social listening at scale. So we are not recommending that this is the only platform that you need to use, but whatever platform you use, you can actually make use of the features and the standards that have been set here. And also we can learn from what your experience has been and is going to be. So strong social listening allows us to pick up what communities are telling us, often well before a crisis fully unfolds or an infodemic really takes off. Looking ahead, I hope we can continue this conversation and this partnership on how to further strengthen our listening mechanisms in an ethical and transparent manner and not an opaque manner. And more importantly, how to ensure that the insights that we gather are consistently translated into meaningful actions, interventions, and responses that shape our health interventions and policies, so that they can truly serve communities that we aim to protect from health emergencies and other health hazards. So thank you once again for your time and commitment, and I look forward. We are really encouraged by this very large participation of over 50 people, and we would look forward to much more engagement as you share this information with your other colleagues and other partners, etc., who are not aware of it, so that there is a snowballing effect and we'll have lots more people joining both the community of practice and this specific instance or this particular platform of the community of practice. So thanks again, and I look forward to our continued collaboration and seeing you again at our next webinar, which will be announced soon. And over to you, Fernan and Debbie, for any announcements. Thank you very much.
And maybe, of course, on that note, I will end the webinar today. Thanks again for your time. Thanks for joining. And I hope we learned a lot in the webinar today. And I'm really looking forward to your participation in our upcoming webinars. So have a great day and stay healthy.